a subacute and chronic inflammation of the GI tract that extends through all layers. Although changes can occur anywhere in the GI tract, they most commonly occur in the distal ileum and, in a lesser degree, in the ascending colon. It has periods of remission and periods of exacerbation. It is due to the genetically predisposed individuals and allows bacteria to invade the gut mucosa, resulting in an overactive adaptive immune response. Crohn's is usually characterized by the gradual onset and a prominent right lower abdominal pain, diarrhea that is unrelieved by defecation, cramps that are due to the inability of the intestine to transport products of the upper intestinal digestion through the constricted lumen, a decreased appetite due to the cramps, which causes weight loss, malnutrition, and anemia. Perforated intestine causes abscesses, which can lead to fever and leukocytosis. A chronic symptom is steatorrhea, or fat in the feces. Fissures, skin lesions, ulcers, and ocular disorders are also common. Nursing management should include pain relief, asking about the character, the onset, the pattern, and how easiest the pain is relieved, administering meds as prescribed, repositioning the patient, applying heat, using diversional activities, and keeping the skin of the perineal area clean, and using ointment as prescribed, reducing the patient's anxiety, establishing a good rapport with the patient, keeping them calm and confident, allowing the patient to ask questions and answering their questions as good as possible, expressing any feelings of concern.
A proctosigmoidoscopy is usually performed initially to determine whether the rectosigmoid area is inflamed. A stool examination is also performed. The result may be positive for occult blood and steatorrhea. The most conclusive diagnostic aid for Crohn's disease has classically been a barium study of the upper GI tract that shows a string sign on an X-ray film of the terminal ileum, indicating the constriction of a segment of the intestines. Newer studies such as the video capsule endoscopy are gaining favor because they can provide extensive evaluation of the small bowel. Endoscopy, colonoscopy, sigmoidoscopy, and intestinal biopsies may be used to confirm the diagnosis. A barium enema may show ulcerations, the cobblestone appearance, fissures and fistulas. A CT scan may show the bowel wall thickening and fistula formation. A complete CBC is performed to assess hematocrit and hemoglobin levels, which are usually decreased, as well as the white blood cell count, which may be elevated. The ESR is usually elevated. Albumin and protein levels may be decreased, indicating malnutrition. Treatment strategies for Crohn's disease focus on nutritional support, symptom relief, and complication minimization. Dietary managements usually include a low residue, high calorie, high protein diet. Multivitamin supplements and TBN are normally added into the diet as the disease progresses. Pharmacological managements usually include antidiarrhea agents, aminosalicylates, glucocorticosteroids, immune modulators, biological agents, analgesics, and antibiotics if infection persists. Complications of Crohn's disease include intestinal obstruction or stricture formation, perianal disease, fluid and electrolyte imbalances, malnutrition from malabsorption, fistula and abscess formation. Patients with Crohn's disease are also at an increased risk for colon cancer.